Like most people with loved ones at nursing homes, Tracy Hawkins hasn't been able to visit her aunt since the pandemic began.
That's been hard because I am the one who was here on a regular basis. I would check in, I would do laundry.
Tracy's 83-year-old aunt has advanced Alzheimer's. She moved to Blue River Nursing and Rehab about a year and a half ago.
My job is to advocate for her, to take care of her, to do everything in my power to speak for her since she is not able to.
For Tracy, that meant asking a lot of questions about Blue River's response to COVID-19. In a May email, she asked if her aunt was being tested regularly. The director responded residents are assessed every 12 hours.
At the time, I accepted the answers. Now looking back, it's like, wait. Those are non-answers.
Tracy also wanted to know if staff members were being tested. The director said yes, every time staff enters the facility. Data Blue River posted on its website shows 0 cases all across the board from March to early June. Then on June 4th, the first staff member tested positive. And on June 23rd, the first resident. It only went up from there.
There were 23 positive tests, and then there were 63 positive tests, and then there's 71. So I need the communication. I needed to know what's happening, and I didn't feel like I was getting direct and complete answers.
The communication she did get was alarming.
And then I got a phone call that my aunt tested positive, and she was moved to a hall where other positive patients were. Then I got a phone call that it was a false positive. Someone read it wrong.
Her later tests came back negative, but overall, Blue River had 71 cases. That's at a facility that averages 130 residents. 11 people died.
11 deaths out of our 50 in the city is, a huge number.
But the city's health director says the number should also be put in context.
9 of those patients were on hospice, so the deaths might have been preventable if they had wanted extra medical treatment.
The regional director for Blue River declined our offer for an on-camera interview, but she did answer some of our questions via email. According to the director, testing of staff and residents didn't begin until June 24th. Now keep in mind the first staff member tested positive 20 days before that. In a statement, the regional director wrote Blue River is taking proactive measures, including restricting entry, monitoring staff and residents for signs and symptoms, continuous training of staff, and stockpiling PPE. She said the facility is in constant communication with state and county health center officials to ensure all appropriate steps are taken to reduce risks.
We all can learn to do better. And I believe that this facility is managing this much differently than they did early on.
On the communication front, Blue River says families have access to its website 24/7 if they want info and daily updates. Hawkins says that's not enough.
I need peace, and I need to know that she is taken care of. And in order to do that, I need direct answers no matter how hard they are. I need to know the truth.
We spoke to another family member that has a loved one here at Blue River. That family member did not want to go on camera, but they shared the same concerns about transparency and communication, as well as some concerns about staffing shortages here. I'm consumer IT reporter Kat Reed, 41 Action News.